A general rule of thumb with dealing with neck stretches is you want to make sure that if you ever experience lightheadedness or pain, you need to stop immediately and tell us in the office about your experience. Otherwise, the neck stretches will be imperative to help you with the process of getting rid of the subluxation in the neck and maintaining and supporting your adjustments. We're going to start with the neck roll, and the neck roll needs to be done slowly, no jerky movements, and it needs to be held. With the stretch, you want to hold for 15 seconds. With the neck roll, we'll begin by lowering our head to the side, laterally flexing, and then rolling downward, and then up to the other side, and then coming back to a neutral position, and then going back the opposite direction, and coming back up. You want to do 5 to 10 of these per stretch, and you want to get a nice even stretch. Make sure that you're pulling, allowing the weight of your head to pull and stretch the muscles. The tension release stretch will help loosen up the traps, help loosen the shoulders, bring down tension headaches, and it will help the overall improvement of the neck. First, what you want to do is take your opposite arm with your right arm. Alyssa will be gently allowing her head to drop to the side, and at the end you want to pull for 15 seconds lightly to a maximum stretch in through the shoulder. You want to hold for 15 seconds, and then after 15 seconds, you want to just go another 1 to 2 degrees that your body will allow. There will be a release, and you'll be able to go just a little bit further with that stretch. And you always want to do the opposite side. So we'll come back to the other side, and remember to do it slowly. You should feel a pull. There should never be any pinching or pain. Should be a light pull on the muscles and a good stretch. You want to keep that opposite shoulder over here. You want to keep this shoulder down. You don't want to bring that shoulder up. Okay, and you want to do the frequency should be 5 of these, and you'll do a total of 30 seconds on each side with 5 repetitions. The flexion tension release is when you allow your head to come forward. You want to lightly and gently pull down slightly for 15 seconds. Allow the stretch to take place. Then after 15 seconds, there will be a release, and you should be able to go an extra 1 to 2 degrees, and Melissa did that. You should feel a pull all the way down in between the shoulder blades, all the way up into the skull. Again, the repetition should be 5 each. The chin tuck is an important stretch for people who are on the computer often, for people who are driving for long distances. We tend to bring our ears in front of the shoulders and put a lot of tension on the muscles in the back of the shoulders here and into the neck. So the chin tuck helps alleviate that. And what you want to do is take your hand and place it on your chin and go straight back. And you picture a line going straight from your nose to your ear, and you want to just go straight back. You want to hold for 15 seconds, and then at the end of 15 seconds, you should have just a little more stretch to go, and then hold that for an additional 15 seconds. The extension stretch is an excellent stretch where you can do this in the car or anywhere. You can bring your head back into extension. Don't do it while you're driving. Allow your head, the weight of your head, to drop down. You want to hold for 15 seconds. The reason why we hold for 15 seconds is there is a natural stretch reflex where the muscles actually tighten up first, and then they slowly release and allow a further stretch. And research shows that this is the best part. And you can use your hand at the end of the second part of the 15 seconds to get that added stretch. This stretch is an excellent stretch for stretching the anterior top part of the front top part of your chest. and the front neck muscles. This is one also that you have to keep in mind, that if you feel dizzy, lightheaded, or you feel pain, stop immediately and let me know about it. After we've done the stretches for the cervical spine, we want to strengthen and support what we've done with the adjustments. And the isometric exercises for the neck are excellent. A lot of female patients come in with their muscles less developed, and we need to support that. So the first isometric exercise is from the front. You want to use your 4 fingers, and you're basically pressing forward with your neck muscles and resisting it, trying to keep yourself in a neutral position, but you'll feel the pull in the muscles in the front, and this is helping the upper chest muscles and the muscles in the neck in the front. Also can help firm up the neck for those who want to improve their look. This over here in the back, we want to do the back, and you want to hold for about 10 seconds, and you want to do this 10 times each. Also from the side, you want to do lateral flexion, and the motion is a sideways motion, but you're resisting that motion with your hand. You want to keep your neck in a neutral position. And then also on this side. Remember to do all 4 sides with this isometric exercise. There should never be pain with this exercise. If there is, let us know. Many patients come into our office with a decreased range of motion and rotating their neck, looking over their shoulder, for instance, in the automobile. This exercise will strengthen those muscles. Remember, with this exercise, the rotation isometric exercise, you want to stay in a neutral position, but you're going in that range of motion, or you're actually using the muscles that you would use if you were rotating your neck. Alyssa brings up her hand, and she is making the motion. She's actually resisting the motion of rotating her neck to the left here, and resisting that with her left hand. But stay in a neutral position. And then you want to hold for 15 seconds, and then do the other side. And you want to do, the frequency would be 10 of these. The rules for stretching make sense. First, warm up. Go for a brisk walk or march in place. You want to increase your muscle temperature so that you get a mild sweat going. That's when you get the benefit of the maximum stretch. Second, a gentle stretch. Never bounce. You should feel pull, but no pain. You should feel good when you stretch. If you get pain, stop immediately and tell me. Third, hold for 15 seconds initially on most of the stretches, then progress an additional 1 to 2 degrees gently and hold for another 15 seconds to get your maximum benefit. 4, breathe deeply with the abdominal breathing and relax. 5, stretch both sides for balance and symmetry. 6, avoid all stretching or exercise if experiencing acute severe pain. Early exercise and stretching could make it worse. If in doubt, call us. Walking is usually okay in most instances. 7, be sure that the individual case does not limit you in these exercises and stretches. Past spinal surgeries, spondylolisthesis, or malformation can limit your participation in these exercises and stretches. 8, if you feel dizzy, lightheaded, or have pain during any of the following of these exercises or stretches, tell us immediately and stop immediately. Number 9, doing these consistently will keep you healthier, keep you active, and maximize your experience in our office. Try it for 21 days and see and feel the results. They will carry you through the rest of your lifetime. In conclusion, every process takes time. Healing takes time, putting braces on your teeth takes time, and if you're patient and do the things that we ask you to do with the stretches and exercises, I ask you to do them for 2 to 3 weeks, and if the benefits alone don't motivate you to continue, then stop them. But we also need you to watch your ergonomics on a daily basis and watch those pitfalls that can get in the way of your healing at the fastest rate possible.